In this video, we will be covering the mandibular second premolars, known as number 20 and number 29 in the universal numbering system. Today, we will be looking at tooth number 29. In children, mandibular second premolars calcify at 27 to 30 months old. These teeth complete their crowns at 6 to 7 years old, erupt at 11 to 13 years old, and complete their roots at 12 to 14 years of age. What's most unique about this tooth is that while the other premolars have only one lingual cusp, the mandibular second premolar can have two lingual cusps. The three-cusped mandibular second premolar is more common than a two-cusped mandibular second premolar. Other differences between the mandibular first premolar and the mandibular second premolar will be pointed out as we go through each view of this tooth. Now we will take a look at all aspects of the tooth, beginning with the buccal. Starting with the buccal aspect, we can see that the distal cusp ridge is longer than the mesial cusp ridge. As a result, the buccal cusp tip is slightly mesial to the midline, just like with the mandibular first premolar. Both the mesial and the distal sides are slightly bulbous. The buccal cusp tip is also less pointy. From the mesial view, we can see that the tooth has a rhomboid shape to it, just like with the mandibular first premolar. The biggest differences are that there is no mesial-lingual developmental groove, there is no mesial or distal crown or root developmental depression, and the tooth is wider buccolingually than the mandibular first premolar. Lastly, if there are two lingual cusps, then the distal lingual cusp cannot be seen from this view because it is smaller than the mesiolingual cusp. In the lingual view, unlike the mandibular first premolar, the mesial marginal ridge is more occlusally positioned than the distal marginal ridge. This tooth also always has larger lingual cusps than that of the mandibular first premolar, although the lingual cusps will still be smaller than the buccal cusp. If there are two lingual cusps, then the mesiolingual cusp will always be larger than the distolingual cusp. Looking at the distal view, we can see that the buccal height of contour is in the gingival third, while the lingual height of contour is in the occlusal third. This is the only posterior tooth with its lingual height of contour in the occlusal third. If there are two lingual cusps, then both the distolingual cusp and the mesiolingual cusp will be visible because the distolingual cusp is smaller. Next up is the occlusal view. In all cases, the occlusal surface is square-shaped. If there is only one lingual cusp, then the grooves are H-shaped. If there are two lingual cusps, then the grooves are Y-shaped. If it's two lobes, it'll be a crescent-shaped groove or a smiley face. The mandibular second premolar has mesial, distal, and lingual grooves and a central pit. Now let's take a look at the root and the pulp. The mandibular second premolar usually has only one root, one canal, and two pulp horns, with the buccal pulp horn being bigger. Notably, this tooth has wider and longer root than the mandibular first premolar. So that was our review of the mandibular second premolar. Check out the rest of our dental anatomy videos on mydentalkey.com. The 3D images used in this video were brought to you by BoneBox. BoneBox is a great resource for learning dental anatomy. Check them out in the App Store today.